So let's have a look at our first question. A patient presents with angular cheilitis and you decide to perform some blood investigations. Which one of the following is not relevant to angular cheilitis? So immediately whenever I read this question, the first thing that I think of is angular cheilitis is a fungal infection. It has a predisposition with low hematological certain things like B12 and iron. The other thing to bear in mind is that there's also a link with diabetes. So if we go through and look at our options and we can decide which ones are relevant or not. So a full blood count, yeah, it's relevant. It's not the most relevant one. Fasting venous glucose, again, that ties back in with our diabetes that we were just talking about. Vitamin B12 is a big one. We want to be testing for that. Liver function tests, ferritin, definitely we want to be looking at that as well. I would say which one of the following that is not relevant to angular cheilitis is going to be D, the liver function test. So this is something that comes up a lot, and it comes up in part 2, probably more than part 1, but this is the SLOB rule, and it's a really, really important one to know because they can ask a lot of different questions about this, and I've just listed a few of the different questions and the types of questions that they will answer here. So let's have a look at this specific example, and I just want you to bear in mind those questions that we were just talking about. Actually, I'll just put them up on the screen now. And if we just answer these questions then now and related to this particular example. So name the technique. We know this is the SLOB rule that we're using. What type of shift is happening? Well, in this case, we've used 2 periapical x-rays and the tube has shifted from the left to the right. So this is a horizontal shift. And identify where something is. In this case, we're looking for the permanent canine. On the one on the left, the canine is kind of over the root of the lateral incisor, and as we've moved the tube to the right, the canine has also moved further to the right as well, where it's now overlapping the central incisor. So it's moved in the same direction, same lingual, so it's on the palatal surface. Other types of x-rays we could have used a panoramic and a PA. We could have used an upper anterior occlusal. There's lots of different options there. As long as you've shifted it in a different way, you can use any 2 x-rays. Nice, we'll move on to our next question, which is going to be about eruption dates, the primary and the mixed dentition. And the question is, what teeth should a 9-year-old have in a given quadrant? So this is also a really common question. It's something that you kind of just have to learn and kind of know, particularly for exams, because they always get asked and it's always guaranteed points for the exam. So A, is it 1-2 CDE 6, 1B CDE 6, C, 1C, CDE, we know that's wrong because they need to have a 6. D, ABC, DE, 6, or E, 1, 2, 3, 4, E, 6. So 9-year-old, they're going to have incisors, they're not going to have upper canines, they won't have premolars, and they'll have 6s. So B is going to be gone, D is going to be gone, we know C is gone, and we know E is gone because they're not going to have a premolar, so the answer here has to be A. Now, anatomy is another question that can come up, and it did come up whenever I was doing the part 2. Now, I would have expected something about the mandible or something about the maxilla, but on my exam it was actually about the orbit, which actually threw me off a little bit. I wasn't expecting that. So I would be prepared for anything in terms of anatomy, but if we look at this, the mandible now, A, these are all things we should know. A is the coronoid process, B is the condyle, C is the mental foramen, D, I think they point to the alveolar process here, E is the mental foramen. There's other ones there, you could be pointing at the body, the mandible, the ramus, the mental protuberance. Any of those areas can be asked on this as well, but do look at the anatomy of the maxilla, do look at the anatomy of the orbit as well. Maybe the nasal cavity as well could be another one, I'm not sure, but be prepared for any anatomy question. Now, for our last question in this video, which one of the following is not a local factor in periodontal disease? Yeah, this is just a straight knowledge question. Is it A, poor crown margins, B, badly designed partial denture, C, smoking, D, diabetes, or E, mouth breathing? So straight away you can say 3 of these are definitely local factors. The crown margins, the partial, and the mouth breathing, those are all things local to the mouth. Smoking and diabetes is definitely not a local factor, whereas you could argue that smoking is a local factor, particularly for periodontal disease. You know, it's a local impact it has on the gums themselves. So for this question, I would say that D is the right answer.